right, so it looks like we're going to be talking about your recent diagnosis of hyperlipidemia. Could you tell me a little about that and maybe what your doctor explained to you about hyperlipidemia?
Yes. So I've never had a problem with it before, or with my cholesterol, but apparently my bad cholesterol is high. And so far that's it. So he just recommended that I come and talk to you so you can help me find ways to hopefully lower it.
All right. So let's just talk about what hypercholesterolemia is first. So it's actually a term that's used to refer to a few different abnormalities in serum lipids. So that's your cholesterol levels, basically. So technically it refers to a high level of cholesterol in the blood. So that could be total cholesterol, that could be LDL cholesterol, or it could even be triglyceride levels. So in your case, it's just going to mean that your LDL levels are a little high.
Okay.
So there are two different types of factors that could be at play. It has a genetic factor and also environmental. So that would include things like our lifestyle habits and diet. Do you know anyone that had hyperlipidemia in your family?
My dad was diagnosed with high cholesterol, but he's just on medication. He doesn't really do anything else for it.
Okay. So do you have any questions before we begin?
No, not yet.
All right. So first we're just going to talk about some of the nutrition therapies that are common for elevated LDL levels. So we want to try to limit our intake of saturated fats, trans fats, and cholesterol. In addition, we're going to be trying to replace some of those saturated fats with our more healthy fats like our mono and polyunsaturated fats. We're also going to be trying to consume an adequate energy intake so that we can either maintain or get to a healthy weight, because that's a big factor as well. And we're also going to try to be doing things like increase our intake of omega-3 fatty acids, as well as our fruit and vegetable consumption and fiber intake. All right. So today we're only going to be covering a couple of these topics so that we don't overwhelm you. So today we're really going to focus on fats. So we're going to be learning about the different types of fats, our unsaturated, saturated, trans fats, and cholesterol. And we'll also be talking about different sources of these fats.
Okay.
All right. So what do you know about fats to start?
I know that trans fats are bad,
Okay.
and you're trying to not eat as much saturated fat and use other kinds of oils, but I'm not entirely sure what that means because there's a lot out there.
Okay. Yeah, so it seems like you know some good stuff to start with. So the common categories of fat that we're going to be talking about are monounsaturated, polyunsaturated, saturated fat, and then trans fat. Have you heard of those before?
Yes, I have heard of them.
Okay. So the difference between these fats is really going to be in their chemical structure. We're not going to get into that a whole lot, but it's just important to know that it does determine how they act in our body. Do you know which fats are better for our health? I mean, you obviously know that trans fats.
Yeah, between the other ones, I don't really know one's better than the other.
Okay. So monounsaturated and polyunsaturated fats are going to be better for our health than saturated and trans fats. So these fats tend to be liquid at room temperature, and we want to try to choose them more often because of the health benefits that are going to go along with increasing our intake. So I have some examples. I have some olive oil here, and as you can see, it is a liquid at room temperature. Same with avocado oil. That's going to be another good source of monounsaturated fats. So both of those would be pretty good choices for cooking, or anything really. Okay, so monounsaturated fats, what they actually do for our cholesterol levels, they help to decrease our LDL cholesterol, which in your case, since you have increased LDL cholesterol, that's really important. And they also help to increase our HDL cholesterol, which is our good cholesterol. So we actually want our HDL cholesterol to be higher. So that's what those are going to do. We also do recommend increasing our intake of polyunsaturated fats. they both lower HDL and LDL cholesterol. So some polyunsaturated fats are going to be really good sources of omega-3 fatty acids, which are beneficial for hyperlipidemia because you are at an increased risk for heart disease, and reducing inflammation can be really important when we have that risk factor. Some polyunsaturated foods do contain omega-6 fatty acids, and so we do want to kind of try to avoid those foods. Not all polyunsaturated fat sources, but just some. So those can actually promote harmful cell inflammation, so that's why we want to try to avoid them. Saturated fats and trans fats can increase the risk of heart disease. So these fats are solid at room temperature, so we always use butter as the example. So as you can see, it is a solid at room temperature. Saturated fats increase LDL cholesterol in our blood, and we want to try to limit them as much as possible. So what would be good is to try to replace them with more mono and polyunsaturated fats if we can. Trans fats are particularly bad because not only do they increase your LDL cholesterol, they actually decrease your HDL, so that good cholesterol that we want to be higher. So it's really important that we are just reading labels, because that's really going to help us to identify which foods are going to be sources of trans fat especially. So this is really common with coffee creamers. If you look on the label, it's going to be a source of trans fat. So about half a gram of trans fat in a tablespoon of creamer, coffee creamer.
It makes me very sad.
I know.
I like my coffee creamer in the morning.
But there are always things that we can replace with some healthier options so that you can still enjoy those foods that you like to eat.
Okay.
So, before we move on to sources of fat in our diets, do you have any questions about the different types of fat?
No, not right now.
Okay. So we're just going to go through some main sources of fat in our diets. This is going to be general sources of fat. So big one is going to be the fats that we use in cooking. Fats that are added to foods like butter, margarine, sour cream, things like mayonnaise, salad dressings, gravies. Those are all going to be some potential sources of fat. Cheese is a big one. So especially in the American diet, we use a lot of cheese. Fatty meats can be a big source of saturated fats, especially. Whole milk, and then more of your processed snack foods, so things like cakes, cookies, pies, crackers, chips, other snack foods. And then, of course, fried foods or fast food. So are any of these foods that you commonly eat that we'd maybe need to, try to replace?
Well, I do cook with butter a lot.
Okay.
I do like cheese. I don't eat a lot of snack foods, but I honestly don't necessarily look at the type of fat that's in it on the ones that I do eat. And I don't really eat fast food a whole lot, but when I go out to eat, I don't really pay attention to what the fat content is.
Okay. So those are some things that we can try to work on together.
Okay.
So common sources of monounsaturated fats. So these are things that we could try to maybe replace some of those other fats that you use in cooking, like butter. We could try to replace them with some of these. So olive oil, of course, I've said, is a really great source. Canola oil is great too. Sesame oil, avocado oil is going to be a good source. And then in general, foods like nuts, olives, avocados, again, are going to be really high in those monounsaturated fats. Some common sources of our polyunsaturated fats are going to include things like salmon, sardines, mackerel. Again, canola oil is going to be a source of both mono and polyunsaturated. Walnuts are a good source of polyunsaturated, as well as flax or flaxseed or ground flaxseed. So polyunsaturated oils, such as corn, soybean, cottonseed, sunflower seed oil, those are relatively new food products, and they do contain omega-6 fatty acids. So those are the omega-6s that are found in polyunsaturated fats, in some polyunsaturated fats. And they do increase inflammation, which can be harmful. So we do want to try to avoid those. but we can still increase our intake of those polyunsaturated foods that are going to contain omega-3s. So more of the salmon, sardines, those kind of foods. So common sources of saturated fats, butter is a big one. Fatty meats, high-fat dairy products, coconut oil, palm kernel oil. So those are going to be some of the highest sources of saturated fat. So especially looking for those when you're purchasing food, looking at your ingredient label, it's really important. And then lastly, we have our sources of trans fat. So coffee creamer is one.
Yeah.
As well as processed foods that use hydrogenated vegetable oils. So that's just something that you'd have to be aware of so that you can look on your ingredient list. And then of course margarine, shortening, gonna be big sources of trans fat. Alright, so I know we covered a lot today on fats, the types of fats, and increasing our intake of mono and polyunsaturated fats and decreasing saturated and trans fat. Do you have any questions?
No, I think I'm going to try to work with some of these new fat options and see how it goes. I may have questions for you later.
Alright. Well, I do have some handouts for you just to make transitioning, a little bit easier. So I have this handout for you on fats and cholesterol. So it just kind of goes over different types of fats and oils and how they're not all the same. It talks about the different types of cholesterol, and then these two handouts are just going through some common myths about different types of oils. So we have monounsaturated, polysaturated, and trans fat on here. So that's
Perfect.
for you to help you.
Thank you.
So thanks for meeting with me today, and if you do have any questions, please feel free to contact me before our next meeting.
Great. Thank you very much.